Hello friends, we are here to discuss about prostate cancer screening. A little different topic today because it is very much important for all of us to get sensitized about it, to get educated about it. So let's first understand about the principles or the numbers of prostate cancer. So to speak, prostate cancer is the second most common cancer in a man. Exact percentage wise 14.3% in all cancers across the globe in men, preceded by only lung cancer, which is 14.6%. And the way the prostate cancer numbers are rising, it will soon be the most common cancer in a man in another 1 or 2 years. That's why it is very much important. If you see the practice pattern in the Western countries, talking about America, after the age of 55 years, there is a standard prostate cancer screening which happens to every man once a year. In European countries and United Kingdom, after the age of 50 years, every man undergoes these particular screening tests. So what all are these tests? It's a simple combination of two tests. One is prostate specific antigen, which is a simple blood test. The results will be available within 4 to 5 hours, and a quick examination done at the bedside as a part of consultation. So combination of these examination and PSA test with in a majority mass scale population would rule out majority of the cancer. That is what the screening means. So in screening, essentially, you are trying to apply some battery of simple tests which should be cost effective, which can be applied at mass population for ruling out early cancers with good sensitivity. If you have understood the meaning of all five or six words which I have used in the previous sentence, it generally tries to pick early cancers in a mass population or the community level. So the people who are actually getting subjected for these tests are not the patients, they are healthy individuals like us, and after certain age cutoffs, these screening tests would have certain important role. Exactly discussing about the similar standards in female counterparts, there is a robust program of mammography, which is a screening test done for breast cancer, or cervical pap smear, which is a test done for cervical cancer, and after certain age groups, depending upon the indications, these tests are recommended for all females. So in a man, this is the only purely screen detected cancer, and these particular tests should be done from the age of 50 years as per the European and United Kingdom standards. Unfortunately, in India, we do not have that awareness about this particular cancer. We majority of the times get patients when they present with a distant spread of a cancer to go to different body parts in the bones, because this particular cancer has a strong affinity to go to bones. So when the patient presents with bony pains, sometimes rarely paraparesis because of the fractures in the spinal column, that is the time when we detect prostate cancers in India, which is actually a shame because it's a purely screen detected cancer. The proportions of cancers getting detected in the late stage or stage 4 till date, in spite of having little awareness, is still higher, and that's why we need to think over it and we need to act over it. Those patients who have a prostate cancer in the family, it sometimes runs in the families. So their family members or all the male members of their family should be actually testing these PSA tests starting from the age of 45. So high risk possibilities or high risk for the patients or population should be doing it little early, and this goes on till the patient is fit until 70-75 years. So screening in prostate cancer is very, very important to rule out to rule out cancers at the mass community, or I would put it in the other way, to detect cancers in an early stage before it goes to before it becomes locally advanced or metastatic. We have discussed this in one of the previous sessions that any cancer overnight doesn't spread to different organs. It takes months to years for a particular cancer, especially for prostate cancer, which are relatively slow growing cancer. It takes months to years for the cancer to spread from prostate to different body parts of the bones. And hence, prostate cancer screening by doing a simple battery of tests once a year, not too frequently, once a year, simple testing would rule out cancer getting detected in the late stage and thereby translating into better outcomes. Obviously, it is important to emphasize here that early detection is a key for better cancer outcomes as well as functional outcomes of prostate cancer. Thank you so much. So come forward for your prostate cancer screening starting from the age of 50 years, and that applies to all men across the globe. Thank you so much.